Hello, everybody. I'm happy to have here EstherSungu from Choice for Life as my guest in this morning. And I want to talk with her about the situation of COVID-19 in West Kenya and at Choice for Life. Ja, herzlich willkommen heute Morgen. Ich bin froh, dass ich EstherSungu da habe, unsere Projektmanagerin von Choice for Life. Mit ihr will ich heute über Covid-19 in Westkenia sprechen und welche Maßnahmen momentan wichtig sind. Hello Esther, thank you very much that you have time for me and I hope you are fine.
Yes, I'm fine, Jörg, from here, from Kenya.
Thank you. In West Kenya, we have the situation that the Delta virus of COVID-19 is spread over West Kenya. Can you explain us something about the situation in Choice for Life?
Thank you very much, Jörg. The situation, as you heard from across the world, Kenya is not an exemption. We are having the COVID third wave, which came from Kisumu. Kisumu is bordering Kakamega, and Choice for Life, our program is in Kakamega. And currently in Kenya, there is a lockdown for Kakamega, Kisumu, and the nearby counties because of the many people that are dying. And that third wave is coming in a way that people don't get ill for a short time. They just get infected, and within a short time, they lack oxygen and they die. And therefore, Choice for Life has been affected in the nearby areas because Shimanyiro being one of our regions, there is a place called Mumbesa where also the problem was, and there is total quarantine. So there are restrictions of movement, restrictions of meetings, and restrictions of economic activities for most of our guardians. Yeah.
I will translate. Also die Situation ist so, dass die Delta-Variante sich besonders von Kisumu aus ausbreitet und Kakamega grenzt also an das County von Kisumu an, sodass auch dort die Delta-Variante sich ausbreitet. Und es gibt starke oder strikte Regeln für die betroffenen Counties, also auch für das Kakamega County und für Choice for Life. Da dürfen die Menschen nicht mehr raus auf die Straße, es sind keine Treffen mehr möglich, es ist kein öffentliches Leben mehr möglich und es sind auch keine kleinen Verdienstmöglichkeiten mehr für die Menschen dort möglich, von denen sie eigentlich abhängen. Ein großes Problem ist auch, dass Sauerstoff fehlt und dass auch deshalb viele Menschen sterben. Can you explain us something about how are the poor people impact of the situation?
How
are the poor people, maybe of Choice for Life, are suffering in this situation?
Yeah, the entire region, there is a problem because in Kakamega, it's a small city, but where Choice for Life are is in a village, and most of the people who get affected there, they don't have means of transport to rush to hospital. And the nearby hospitals are very local hospitals where maybe the oxygen and the gadgets for emergency are not very well equipped in those hospitals. And so, again, most of the people there don't have enough money to buy the masks. In Kenya, averagely 20 shillings for one mask. And an average family has maybe 6 people. So that is 120 shillings, which is the daily income for an average Kenya. That's like $1. So $1 spending on a masks every day, it's a problem. So prevention is a challenge. And again, the hospital facilities have no equipments for oxygen emergency. And that is really making the situation to be bad in terms of prevention and treatment.
Also die Krankenhäuser, die gut ausgerüstet sind in den Dörfern nur sehr schlecht zu erreichen. Gut ausgerüstet heißt aber auch, dass es trotzdem nicht reicht für alle Fälle, um kranke Menschen zu versorgen. Auch die Masken sind sehr teuer, für eine Familie ungefähr $1 am Tag, allein für Masken, das kann sich eigentlich keiner so richtig leisten. Und so ist auch die Prävention sehr schwer und das ist das große Problem.
Again, most people depend on small businesses in the villages, and because they have banned businesses, no shops are open, no selling, and no much business activities. Now the old people cannot get out also from the house. They are vulnerable. The old women, most of our women for Choice for Life are very old. And because they cannot come out, they are quarantined in their houses, in their homes. It is not very easy for them to carry on with the small businesses. And therefore it brings a challenge of food because they cannot go to sell so as to get that profit in terms of like $1 to depend on for the food for their families.
Viele sind auch abhängig davon, dass sie das Geld verdienen auf den Märkten oder über andere kleine Jobs. Und das ist momentan fast nicht möglich, weil aufgrund der Ausgangsbeschränkungen es eigentlich kaum möglich ist, das Haus auch zu verlassen. Und das bedeutet für viele Familien auch Hunger und das Problem, dass es schwierig ist, an Lebensmittel heranzukommen. Und das betrifft vor allem auch die älteren Menschen. Can you explain something about the situations in the hospitals? When somebody reaches a hospital, what happens there?
When they reach the hospital, first of all, we have a problem of health workers that are few. So if there is a district hospital, it carries many people. So when they go there, they get a problem of the ratio of the nurses against the patients is very low. So they also don't allow patient attendants, like the relatives of the person who is sick, to come in because of the infections. Because if they allow them in the hospital, then they will not be controlling the infection. So they only put you put your patient at the gate of the hospital, and once the patient is admitted, the relatives go out. In the process, there is no much also facilities like oxygen to take care of the patient. And because again, we have few health workers, now there is a lot of death rate because of that problem of the oxygen gadgets and also the patient ratio to health worker ratio to the patient. So that is becoming a problem. And also the local hospitals that are near, because when these things, the way COVID is manifesting, it comes just as an emergency. So in the rural areas, before they take to the main district hospital, they go to the sub-county hospital. And the sub-county hospital don't have anything like ICU. They don't have ICU, they don't have oxygen because it is just a local clinic. So they don't have gadgets for emergency, even though the health workers are there.
Also in Kenia gibt es größere Bezirkskrankenhäuser zum Beispiel. Da gibt es Plätze für Covid-19-Patienten, aber das sind viel zu wenig. Auch das Personal fehlt, sodass auf viele Covid-Patienten nur ganz wenige Pfleger kommen. Die Angehörigen können nicht in das Krankenhaus, ähnlich wie in Deutschland, um Infektionen zu vermeiden. Und deswegen ist die Todesrate unter Covid-19-Patienten sehr hoch, weil sie oft nicht angemessen, auch im Krankenhaus, in einem großen Krankenhaus, nicht angemessen versorgt werden können. Auf den Dörfern gibt es Sub-County Hospitals, das sind dann kleinere Krankenhäuser oder Gesundheitsstationen, und die sind auf Covid-19 nicht vorbereitet und haben deshalb auch kaum Möglichkeiten, angemessen darauf zu reagieren, weil es an Beatmungsgeräten fehlt, an Sauerstoff und viele mehr, um auch im Notfall helfen zu können. Now, from your view from Choice for Life, what is important in this situation to help the people?
Yeah, as per now, the situation keeps growing, and prevention is very key, because we may not be doctors, but we can help the community as Choice for Life in preventing, and beginning with our own children and our guardians and the surrounding people. So I think we desire that if we can have masks for every child, because the children go to day school, it's not a boarding school, and they have allowed the children to go to school, but they don't mingle with very many people at the marketplaces. So it is important that every day a child has a mask as they go back home. And it's also important that their guardians also stay safe by wearing a mask. So if we provide masks as Choice for Life, or if we can solidarily come together and look for ways of getting masks, then we can really help by preventing the coronavirus spread. Number two, also, we can also support the guardians by the food, especially those who are vulnerable, like our guardians. If we can help them how to survive by providing them food, it will really help them not dying out of hunger. And then if we can also join the community in fighting the COVID by preparing the sub-county hospitals to have emergency kits like oxygen, the small kits, then it can really help to reduce the death rates so that they can use it as emergency kits for the already affected patients. Thank you.
Also sie hat uns erklärt, dass die Masken weiterhin sehr wichtig sind, um Prävention zu betreiben. Die Schulen haben offen. Das ist einerseits sehr gut für die Kinder, weil es dort auch Essen und Mahlzeiten gibt. Und allerdings brauchen sie da ständig auch neue Masken. Aber auch für die Familien zu Hause ist es wichtig, dass sie regelmäßig neue Masken haben. Und das würde sehr helfen. Die zweite Maßnahme wäre Nahrungsmittelhilfe für die Familien, die besonders stark betroffen sind, um Hunger zu vermeiden. Und das dritte wäre, um ein Zeichen der Solidarität auch mit der Gesellschaft zu zeigen, die kleinen Krankenhäuser dabei zu unterstützen, sogenannte Notfallkits, also so Notfallsets zu erhalten, damit man in ganz schwierigen Situationen auch in einem solchen Krankenhaus handeln kann. Das sind die drei Maßnahmen, die wir gerne unterstützen möchten von Fair Aid e.V. und für die wir auch Spenden sammeln werden. So, thank you very much, Esther, for this discussion. And I hope you will be stay healthy. Also, the team of Choice for Life say greetings from us in Germany, and we hope all the best for the people in Kenya, and we stay in contact.
Thank you.
Thank you very much.
Thank you, Fair Aid.